The spleen is located in the left ventral abdomen along the abdominal wall. Whereas the tail and the body of the spleen are mobile and can cross over the right side, the head is fixed to the gastric fundus, just caudal to the liver and cranial to the left kidney. The spleen is located ventral to most of the intestinal tract and lateral to the left lobe of the pancreas. The cranial portion of the spleen is found variably under the costal arch, which can limit ultrasound access. An intercostal approach may be needed to complete the examination. The mesentery and the jejunal veins are located dorsal to the spleen, just like the splenic vein that joins up with the cranial mesenteric vein to form the main portal vein. A convex probe allows a larger section of the spleen to be scanned and may be more convenient when comparing it with adjacent structures for its echogenicity and echotexture. The examination starts with the head of the spleen, located caudal to the gastric fundus and medial to the ribs. The spleen is one of the most echogenic organs in the abdomen. Its parenchyma presents a fine echotexture, and its veins are anechoic and easily visible as they cross the hyperechoic capsule. Dorsally, you can see a few intestinal loops caudal to the stomach. These intestinal segments are loosely distributed in the mesenteric and omental fat that shows scattered hyperechoic lines. The examination of the spleen is completed caudally and ventrally, covering the rest of the body and tail of the spleen using variable imaging planes. While examining the body of the spleen, the kidney is visualized just dorsally, allowing comparison of respective echogenicity. The splenic parenchyma is normally uniform, except for the anechoic veins and their walls that are hyperechoic when perpendicular to the probe. The size of the spleen is evaluated subjectively and varies depending on the size of the animal. The position of the spleen is also influenced by body conformation. It often crosses to the right side and located under the costal arch in deep-chested dogs, and may be normally larger in certain breeds like German Shepherd dogs. In cats, a body measuring less than 9 mm in thickness is considered acceptable. A high-frequency linear probe, such as 10 to 15 MHz, provides more detailed images due to higher spatial resolution. The larger footprint and reduced artifacts in superficial tissues allow better assessment of the most superficial part of the spleen. The filters used with this particular machine highlight the very reflective capsule, as well as the abdominal wall located most ventrally. The left kidney is once again visible more dorsally or deeply, and its cortex can be compared with the adjacent spleen. Note that the renal cortex is less echogenic than the splenic parenchyma. This type of comparison must take into consideration the progressive attenuation of the ultrasound waves as they travel in tissues. Therefore, the echogenicity of different structures should be compared at similar depth. Color Doppler highlights the splenic arteries and veins with red and blue signals, respectively. Observe the splenic vein that crosses the capsule to carry the flow toward the portal vein, then to the liver. The left lobe of the pancreas can also be found in this area.